who had, well, David Liley is Chief Executive of Brighton and Hove Healthwatch, and he joins me now. I mean, a third of patients not seeing their doctor when they should have. How worried are you by that finding?
Well, we were very worried, and I think the NHS are as well. We did the research jointly with the NHS, and they're taking the results as we are very seriously, and hence encouraging people to re-engage with the NHS. That's not going to be a perfect process because, of course, some of the methods of contacting the NHS are a bit more clunky and difficult than they were. It's not always easy whenever consultations are happening by e-consult digitally, or when the main method of contacting the NHS is initially by phone. But despite all of that, we really encourage people to follow up on their health issues.
And obviously we have been sort of reassured this morning, by the people that we've spoken to, that it is business as usual for the NHS. But there must have been knock-on effects from COVID. And by that, I don't just mean people who chose not to make an appointment, but, existing patients who had treatments or appointments cancelled.
Absolutely. That's been massive. And again, it's completely and openly acknowledged. And the NHS and social care are taking every action they can to try and deal with those issues. There are thousands and thousands and thousands of people whose procedures, whether they're operations, whether they're other sorts of appointments, are going to be delayed, and delayed a very long time. This is not something that the system can switch back into fixing in a few days or a few weeks or even a few months. There may be some outpatient services that are compromised for more than a year, maybe 2 years.
Wow, that is a backlog and then some. And it is reassuring, I think, to hear, as we have this morning, that at the moment, hospitals and GP surgeries here in Sussex are coping well. But I think the worry for a lot of people is that we're heading into this critical winter period. Could services become overwhelmed?
I don't think services will become overwhelmed. They're incredibly well prepared. And just this last week, we've been hearing across Sussex, and particularly in Brighton and Hove, what the winter plans are for the whole system, for health and for social care, the plans of the city linked in with the NHS plans. But I think the system will be stretched. It is going to be a tough winter for all of health and care services, and COVID is certainly not helping with that. But the resilience of the system, the work that's been put in by key workers, and of course the massive effort from the voluntary and community sector has laid great ground for us to be able to get through the winter okay and make sure people get the help that they need. If folks have got issues, then they can go on the Healthwatch website, either the one for Brighton and Hove or East or West Sussex. And we're running a campaign over this lockdown period called Ask and Tell. So ask us any questions you have and tell us about your experiences, and we'll get that information to the decision makers.
And just finally, David, do you feel as though this second lockdown is helping bring a halt to the spread of coronavirus across Sussex and indeed Brighton and Hove?
It is, definitely, and it's massively optimistic to hear that over the last 2 weeks, the incidence of new COVID cases has actually dropped in Brighton and Hove. And it's a bit early to be describing that as a trend, but the biggest fall has been among young people. So it's a tremendous thank you to all the students, all the young people that have really adhered to the advice. They've really stepped up to the mark. And because of that, we've seen massive falls in the incidence of COVID among that age group. What's not so great is that the figures are going up for the over 60s. They're creeping up, but they are going up, not down.
And why is that then? Are they the ones not following the rules now, or?
I think it's very difficult to say, and of course these things are also linked to testing availability. Although testing availability is good across Sussex and good in Brighton and Hove, but what's really important is that folks don't let slip on the basics. All the basic COVID advice is still there. We're all seeing the optimism of potential mass vaccination in the future, but this is not a time for people to change their behaviour. Let's put it this way. If you're over 60, as I am, you don't want to be the last person in Sussex to catch COVID.
On that note, thank you, David Liley, Chief Executive of Brighton and Hove Healthwatch.